I would like you to imagine a system of care that has fantastic results in the care of patients with diabetes and other medical conditions. A system that saves 365 hearts, 68 legs, 625 pairs of eyes each year in a diabetic population. And at the same time, this system is saving money, not by denying care, by decreasing waste in the system. And as you may see, this has been found to be true across the United States, from Michigan to Oregon to Wisconsin, the city of Baltimore that decreased Medicaid costs by $2,200, studying endocrinology, a medical journal that showed that glucose monitoring and appropriate care reduced total cost of care by $3,600. And our Palm Beach ACO that we are all so proud of. So this magical system is really the triple aim. The triple aim is a concept created by the Institute of Health Improvement that represents the simultaneous pursuit of three goals: improving the patient experience of care, improving the health of populations, and reducing per capita cost of healthcare. When I learned about this way of doing things about 4 years ago in a conference at the IHI, we wanted to bring a pilot program to Palm Beach County. And that's what we did. With the help of the healthcare district, we got a grant and went to San Diego to an IHI conference, and we learned how to put together a pilot program that we call it the Diabetes Initiative Triple Aim Program for Palm Beach. We had a mission and vision as is depicted in this slide. We wanted to have a triple aim program focusing on low-income and uninsured patients with diabetes in the county. And our goal was to partner with everybody in the community to accomplish this goal. And as you can see, these patients have economic difficulties, and the healthcare district pays for the care of many of these patients, so our resources are very limited, so we have to use them very carefully. We team with many leadership organizations, as per the slide. And just to highlight the PALM Foundation, the Quantum Foundation, and the Healthcare District who help us with financing this enterprise. I'd like to make 2 points about why this system works. The first point to remember is that we have to understand that healthcare and health has many determinants, and access to clinical care is only 20% of the final outcome. Your health behavior, your social and economic factors are much stronger predictors. So if you want to change the whole system, you have to have a comprehensive, holistic approach to the problem. This system will not work if we don't have engaged patients. Engagement defined as a patient who is knowledgeable, who has the ability and willingness to manage their own healthcare. And we will have to create a culture to support patient engagement. In our model, we have, as a healthcare coordinator, as one of the main elements to accomplish this goal. So in our clinic, we have a healthcare coordinator that establishes a rapport and patients with the patients through motivational interviewing, doing reflective listening, empathy, and the whole idea is to improve patients' adherence. We also collect data for analysis to improve the system as we go along. I'd like to recognize Dr. Stuart Miro and Thomas Sebastian, who are our local experts in healthcare coordination. Right now, we have about 31 patients enrolled, and we have patients in the JFK Clinic, in internal medicine, and the healthcare district. And we have in each clinic a point of contact person that help us to identify the persons, the patients. Patients who have high hemoglobin A1C levels, they have to have low income, residents of Palm Beach, and they have to be willing to participate in the program. We also are training points of contact persons, and hopefully coordinators of care who speak Creole and Spanish to improve the cultural sensitivity aspect of our program. This is just a busy slide, but just to let you know that when the patient comes to the clinic, they have a 3-hour education diabetes class, and they see their physician, a plan of care is made, and the care coordinator plays a very important role, making sure the patient understands their plan of care. They have follow-up phone calls to answer any questions or to reinforce the plan of care, and this is working. We have data for 2 quarters, and the hemoglobin A1Cs have dropped from over 10% to a little over 7%. The satisfaction in the red line has improved, and blood glucose levels, of course, have decreased. The blood pressure is also trending down. The numbers are small, so we don't have a statistical analysis yet, but the data is certainly is trending in the right direction. And the patients are adherent to their treatments. They are coming, 75% of them came for their specialty appointments. They came to the diabetic sessions, and most of these patients are insured by the healthcare district, which is the insurer of last resort in Palm Beach. Early financial analysis is predicting savings, and we are planning to expand this program to several hundred patients once that this pilot is already completed. This is really the ultimate goal. Health Partners in Minnesota is one of the best systems in the world accomplishing the triple aim. In the red line, you have the improvement in the diabetes management of these patients. And the blue line is the patient satisfaction with their care, and the green line, how the cost is dropping. Health Partners in Minnesota spends 10% less than the average cost of care in the state of Minnesota. It has been estimated, one other point, the satisfaction of the physicians working in that system went from the 25% percentile to 82%, the 82nd percentile based on the Medicare Group Management Association survey. As we've been discussing, one of the most important things that a physician gets is when we see that our patients do well. It has been calculated that the healthcare partners' best practices were adopted nationwide. The country will save $2 trillion in 10 years. Now, when we started the Future of Medicine Conference in 2007, we talked about the 4 pillars of access to care: safety, quality, prevention, wellness, physician practice, viability. Certainly, these goals are still active today, but I would like to suggest to you that now we should have the quadruple aim of better health, better care, lower costs, and satisfied physicians. Thank you.